Welcome to my channel Vital Scope, your go-to hub for health, fitness, nutrition, and wellness tips. Stay informed, stay healthy, and live your best life. In this video we talk about these 9 warning signs of stroke 1 month before. Don't ignore them. Introduction: the critical importance of early stroke warning signs. Stroke is a medical emergency and one of the leading causes of disability and death worldwide. What makes strokes so dangerous is that they can happen suddenly and with devastating consequences. However, research shows that many strokes are preceded by warning signs that may appear days, weeks, or even a month before a major stroke event. Recognizing these early signals gives you or your loved ones a crucial window to get urgent medical help, potentially preventing a full stroke or minimizing its impact. In this video, we'll explore the 9 warning signs that your body might show 1 month before a stroke, and why ignoring them can be deadly. 1. Sudden weakness or numbness on one side of the body. One of the most common early signs of an impending stroke is sudden weakness or numbness in the face, arm, or leg, especially if it's only on one side of the body. You might notice that one side feels heavy or difficult to move. For example, your smile might become uneven, or one arm might feel weak when you try to lift it. Sometimes this weakness is temporary, lasting only a few minutes or hours, but it's a serious red flag. This happens because the blood supply to part of your brain is reduced or blocked, preventing it from controlling muscles properly. 2. Trouble speaking or understanding speech. Communication problems are another early stroke warning. You may find your speech suddenly becomes slurred or slow, making it hard for others to understand you. Alternatively, you might struggle to find the right words or have trouble understanding what people are saying. This difficulty in producing or comprehending speech, known as aphasia, is caused by damage to language areas in the brain affected by poor blood flow. 3. Sudden vision changes. Vision problems can also signal a stroke in the making. This may include blurred vision, seeing double, partial loss of vision, or even temporary blindness in one or both eyes. These visual disturbances occur when the part of the brain responsible for processing vision is affected. Even if these changes resolve quickly, they require immediate medical attention. 4. Severe headache without warning. A sudden, severe headache that feels like the worst headache of your life can be a symptom of a hemorrhagic stroke or other serious brain issues. This headache may be accompanied by nausea, vomiting, or sensitivity to light. Unlike normal headaches or migraines, this kind of headache appears abruptly and intensely without any obvious cause. 5. Dizziness, loss of balance, or coordination issues. Feeling dizzy, lightheaded, or off balance can be an early sign of a stroke, especially when combined with difficulty walking or coordinating movements. This happens because the parts of the brain that control balance and coordination are compromised by disrupted blood flow. You may find yourself stumbling, feeling unsteady, or unable to perform simple tasks like touching your finger to your nose. 6. Sudden confusion or difficulty thinking clearly. Cognitive changes can occur gradually in the lead-up to a stroke. You may feel unusually confused, disoriented, or have trouble concentrating on tasks that were once simple. Memory lapses, trouble understanding instructions, or a general mental fog are all warning signs that the brain isn't functioning normally due to reduced oxygen and nutrients. 7. Persistent numbness or tingling sensations. Numbness or a pins and needles sensation on one side of the body can occur before a stroke. These unusual sensations happen because nerves are not getting the oxygen and blood they need to function properly. It may start as a mild tingling and progress to complete numbness, indicating an urgent need for medical evaluation. 8. Unexplained fatigue or weakness. You might feel constantly tired or weak for no clear reason, even without physical exertion. This unexplained fatigue can be your body's way of signaling that your brain isn't getting sufficient blood flow. It can be easy to dismiss, but persistent tiredness combined with other symptoms should raise concern. 9. Sudden onset of nausea or vomiting. While nausea and vomiting are often associated with digestive issues, they can also occur before a stroke, especially when accompanied by dizziness or severe headache. These symptoms may indicate increased pressure inside the skull or involvement of the brainstem. Why these signs often go ignored. Many early stroke symptoms are temporary and may resolve within minutes or hours, leading people to dismiss them as minor or unrelated issues. However, these transient ischemic attacks, TIAs, often called mini-strokes, are major warning signs. Ignoring them increases the risk of a full, disabling stroke. What to do if you notice these symptoms? If you or someone else experiences any of these warning signs, don't wait. Call emergency services immediately. Time is brain. The faster you receive medical attention, the better your chances of recovery. Even if symptoms disappear, seek urgent care to prevent a major stroke. Lifestyle changes to lower stroke risk. Preventing stroke starts with healthy habits. Control blood pressure, a major stroke risk factor. Maintain healthy cholesterol levels. Manage diabetes effectively. Eat a balanced diet rich in fruits, vegetables, and whole grains. Exercise regularly. Avoid smoking and limit alcohol intake. Manage stress through mindfulness or relaxation techniques. Emergency response. What to do when stroke warning signs appear. Recognizing the symptoms is just the first step. Knowing how to respond can save precious time and lives. If you notice any of the warning signs we discussed, it's critical to act quickly and decisively. Call emergency services immediately. Do not hesitate or try to drive yourself or someone else to the hospital. Every minute counts when dealing with stroke symptoms. Emergency medical teams can begin treatment as soon as they arrive, including administering clot-busting medication if appropriate. Remember the FAST acronym. Face drooping, ask the person to smile. Does one side droop? Arm weakness, can they raise both arms? Speech difficulty, is their speech slurred or strange? Time to call emergency services if any of these are present. Keep the person safe. While waiting for help, keep the person calm and seated or lying down. Do not give them food, drink, or medication unless directed by medical personnel. Medical tests and diagnosis following warning signs. When stroke symptoms are reported early, doctors can perform tests to determine if a stroke or TIA has occurred and what type it might be. CT scan or MRI. Imaging to identify blocked or bleeding blood vessels. Ultrasound, to check for blood flow problems in the neck arteries. Blood tests, to measure clotting ability, cholesterol, blood sugar, and other risk factors. Electrocardiogram, ECG to detect heart rhythm issues that can cause clots. Early diagnosis helps tailor treatment and prevention strategies to reduce the risk of a major stroke. Medications and treatments to prevent full stroke. If warning signs indicate a high risk, doctors may prescribe treatments such as antiplatelet drugs, like aspirin to prevent blood clots, anticoagulants, for patients with atrial fibrillation or other clot risks, blood pressure medications, to keep hypertension under control, cholesterol-lowering drugs, such as statins to reduce artery blockage. In some cases, surgical procedures like carotid endarterectomy may be necessary to clear blocked arteries. How to support stroke recovery if symptoms occur. Even with early intervention, some strokes cause lasting damage. Rehabilitation plays a vital role. Physical therapy, to regain movement and strength. Speech therapy, to recover communication skills. Occupational therapy, to relearn daily activities. Emotional support, counseling or support groups to address anxiety or depression. Lifestyle tips to lower stroke risk. Preventing a stroke involves managing your overall health. Healthy diet, focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular exercise, aim for at least 30 minutes most days of the week. Quit smoking. Tobacco dramatically increases stroke risk. Limit alcohol. Stick to moderate drinking guidelines. Manage chronic conditions. Keep blood pressure, diabetes, and cholesterol in check. Stress management. Practice relaxation techniques like yoga, meditation, or deep breathing. Remember, time lost is brain lost. Don't wait. Seek immediate help if you notice symptoms in yourself or others. Thanks for watching. Don't forget to like, share, and subscribe for more health tips and wellness updates. Stay healthy and see you next time.